Hello, my name's Brooke Ward. I'm the President and CEO of the Washington Health System. It's my honor to be back with you once again for our ongoing Friday video series, where we attempt to give you an update about what's going on in our healthcare world. And once again, like we have for the last 18 months, I want to start with COVID. The CDC has designated Washington and Greene County as high risk for community transmission of COVID. Within the last 7 days, the positivity rate within Washington County has been 7.5%, and in Greene County, it's been a little lower at 5.3%. Now, I can't explain why, but at our outpatient COVID testing sites, the people coming to us, the positivity rate in that same time period is about 12%. So the people coming to us are a little bit more COVID positive than it's been happening at other testing sites for some reason. But that has been our data over the last week. Now, within our hospitals, as of yesterday on Thursday, we had 16 COVID positive patients at Washington Hospital. We had 2 at Greene, and of those, 83% are unvaccinated. That's been our trend for the last month or so. Now, because of the increase in COVID rates across the region, the nation, and our state, no surprise, Governor Wolf announced there's going to be a mask mandate starting September 7th for all kids K through 12 in early learning programs and childcare settings across the entire state. This was put in place to keep our kids safe, keep them in school, and of course, keep COVID, the Delta variant specifically, out of the schools. Our highest priority as a society and as a group ought to be to keep our kids safe. And for that reason, regardless of whether this was put in place by a Democrat or a Republican, I think it was the right policy decision to keep our kids safe. Of course, some of our youth, age 12 and older, are vaccinated, but not all. Having them mask and being protected is still a good idea. And for those kids under 12 who can't get the vaccine, this is their only defense. And so again, regardless of your political beliefs or who put it in place, I do think it's the right thing to keep our kids safe. Now, let me move on to vaccines. We got good news last week, Monday, August 23rd. The US FDA finally approved the Pfizer vaccine for final approval, and we moved it out of the emergency use authorization for people over the age of 16. Now, the emergency use authorization continues to be in place for those 12 to 15 and for those people who need a third dose because they're immune compromised. That's still in place and we can still provide it. Additionally, we're expecting the CDC and the FDA to announce final approval to provide a booster shot for those individuals over the age of 16 for Pfizer and Moderna for starting the week of September 20th. Now, this switch in guidance by the federal government and the CDC comes because of the rise in the highly transmittable Delta variant. At this time, public officials are recommending that people get the booster shot 8 months after they've been fully vaccinated. So that means after their second shot of Moderna or Pfizer. That's when they're recommending it. Now, they could change that down the road, but that's the guidance today. With that news in mind, the Washington Health System is going to reopen our mass vaccination clinics starting the week of September 20th. Those clinics are going to offer Pfizer vaccine to those individuals who are eligible for the third shot. That includes those who are immune compromised or want the booster shot. I've had people ask me, is the actual Pfizer vaccine different? It's the same regardless of which scenario you're talking about. We'll also be allowed in that clinic to take care of anybody who's not vaccinated. So if you need your first and or your second vaccine, we can do it in that clinic as well. The medical community wants to emphasize that it's urgent. It's very important that we all get vaccinated. So if you haven't been vaccinated at all, please come in, let us take care of you and protect you. And of course, if you want a booster shot, we're setting these up to do that. These will be walk-in clinics with no appointments necessary. We're going to have 2 of them to start. In Washington area, we're going to have one at the Washington Hospital. That will be in our Stout Conference Center. When you come in, please park in the main garage, drive all the way to the back, go in the H door, and then we'll be in the Stout Conference Center doing that. That's going to be on Tuesdays from 8 a.m. to 2 p.m. We're also going to do it on Thursdays from noon to 6 p.m. Now, down in Waynesburg, we're going to do it in the Washington Health System Green, the old former Wellness Center space. That clinic will be open on Wednesdays from 8 a.m. to noon every single week. Again, those clinics will start September 20th, pending FDA approval. Now, remember, when you come in to get your third dose or your booster shot, remember to bring your vaccination card with you. If you're under the age of 18, you need to have a legal guardian and a parent with you. And remember, all medical facilities, including when you're getting vaccinated, include at all Washington Health locations, and frankly, all other medical providers, a mask is required. So remember to bring that with you. Now, for the Washington Health System team members, if you want to attend those mass vaccination clinics to get your booster shot or to be vaccinated, just remember to bring your vaccine card if you've already been vaccinated and your employee ID. That will help us out. Now, on top of those mass vaccination clinics, we're also doing scheduled COVID vaccines in 7 of our primary care offices. That would mean family medicine, internal med, and pediatrics. And we've applied for 4 more. We're waiting for the state to approve that. When those get approved, we'll have a total of 11 primary care offices across Washington and Greene County. Those are all scheduled appointments only. So if you don't want to come in for the mass vaccination clinics, you can call and we can schedule it in those locations as well. Moving on, I want to talk about some fun things, some reward and recognition. One of them is the Observer Reporters Best of the Best Award program. Every year they run a contest where they allow the community to vote in a bunch of different categories about who they think the best is. This is, I think, fun and exciting because you get to tell us who you think is best, not only in providing great patient care, but providing service. There's numerous categories, and we've been nominated and passed across dozens of categories, and we are this year as well. We're excited to see what you think about us and our service. If you want to learn more about this, you can go to the Observer's website. This is o-ourbest.com, starting on September 2nd at 9 a.m. to see who was nominated in all the categories. I hope you'll seriously consider voting for us. It's a nice compliment that you give us when you consider us the best, and we're looking forward to those results. Now, moving on to another exciting thing, the Washington Health System Greene Auxiliary last month in August celebrated their 100th anniversary. And I want to just recognize all of the volunteers, the women and men who have worked over the 100 years and still work today, volunteering their time to not only help the community, but the Washington Health System Greene. This is a great group of individuals who volunteer their time to make sure that your experience at our healthcare facilities and at our team members have a good experience. I also want to thank the Observer Reporter. They ran a nice story on the front page last Monday highlighting these individuals and the accomplishment and the anniversary of this group. Wonderful group of people. Thank you for what you do every day, and I wanted to make sure we acknowledged you. Lastly, fun thing, of course, this weekend is Labor Day weekend. It's a national holiday here in the United States, and many of us will be celebrating the long weekend. I just wanted to acknowledge it. I want you to have fun, and hopefully you have a safe holiday weekend. Those are our updates for this month. I hope you found the information useful. I appreciate your time and attention. You can tune in for our next video, which we've scheduled for October 1st. Until then, stay safe.